This is Steph from Surgery App. This is a demonstration of the workflow system. So you can share full screen now, you can see what's going on. So we've got here the website for our test surgery, Regent Street Surgery. We've also got the app open for Regent Street Surgery. Both the website and app have customizable forms pre-built for on-the-day appointment requests or admin requests, whatever it may be, both in the website and the app. So we've built these forms for you from the custom form builder. We can build any kind of form, and we can have the forms open to open on at a certain time and automatically switch off at a certain time, available on certain days. But these will be pre-built for you by us. So the workflow system, depending on what view you set up, this is the workflow management. So if you're a manager, you will have access to all of these tabs here. But if you're been set up as a staff member, you'll only have access to workflow management and registrations buttons. The staff can't change any details in your website or app. So let's go into the workflow system. So this is the workflow dashboard. We can see at the moment we have 0 tasks or 0 submissions, new or in progress, because we haven't submitted any forms yet. Now there's a couple of things you can do. You can set up staff teams. So we've got a few teams set up here already. We've got pharmacy, nursing, clinical care, administration, prescribing, reception. You've got unlimited amount of teams. To set up a new team is very easy. Just click on Add New, put in a pharmacy team 2, and click on Save, and you can see that team has now been added to the teams. You've also got staff members here, so you can invite staff members or add staff members to be registered within your portal. You can see we've got three test staff members here, but if you want to add a new member, very simple, just click on first name, last name, the access level. So manager would have access to all of the tabs here, but staff would only have access to workflow and registrations for GMS1 and new patient check, etc. Put that email address in, and then click on save, and that will send an activation email to the staff member. Once they're registered, they'll have access to the portal at the access level you've granted to them. And once they do have access, you can allocate those staff members to the teams you've set up. So let's, for example, put me in the administration team and reception team for today, and click on save, and that's done. You can also, if patient staff are off on annual leave or on sick, you can put them into different teams so they can cover different teams that day. We'll come back to why you can do that in a second. So let's go back to workflow management. So let's submit a form very quickly so we can see what's going on. Let's submit an admin query. Let's do a very simple one, like nominate a pharmacy. Patient can click on this, put their details in very quickly, put a date of birth in, and select what pharmacy. Let's select, I want my script to go directly to Lloyd's, and click send. That's the success message the patient would have. You can edit this success message, or you can ask us to do it for you. They'll have this if they're submitting a form through the website or through your practice app with the same form here. So it's the same form in the app, and they duplicate what they do on the website. And now if we go back into workflow management, we can see that there is a new submission now. So it's saying there's one new submission there. It's called Nominate a Pharmacy, submitted through the website, and the patient name is there, submitted by myself, and that is new. You can either click on View here, or you can click on New here to access this form. So let's click on View. So let's go back. There's another tile appeared here now to say the title of the form. We've got one sitting in Nominate a Pharmacy. Obviously, we've got lots of forms here. So if we were to submit another form for a different title, subject access request form or application access to health records, for example, then this would show new tiles down here with a number of forms sitting under that tile. So let's access this now. You can view this, and you can see this is a new submission. It's been the patient details and the questions have been asked and the answers there. So let's say that this is pretty easy. I just want to code it to vision blindness. And this thankfully got spell check built in. Then save that. If I save this, we can see that now the audit trail is there. Who clicked on, who did the entry, what time and date. This is done now, so I can say, right, this is now complete. I can click on save, and then I can go back to my tasks. I've got no tasks here. I can go back to the all form submission. It's gone from here. If you want to see the completed, we can go into here, and we can see, yeah, okay, that's been completed, and you can view it, and you can view the full audit trail here. If you wanted to copy this to Vision, you can either copy the questions and answers the patient submitted, and you can click on copy form, and this will just copy this section here. You can then copy and paste that into Vision or EMIS, or you can copy all. So if you click on copy all, this will pick up the questions and the answers from the patient, but also the complete audit trail. So it's entirely up to you on what you want to copy and paste into Vision, either copy form or copy all. And that's it. Now let's submit another form. Again, let's submit nominated pharmacies. Nice and simple, just a couple of questions there. So let's very quickly submit this again. 17/05/1977, and select the pharmacy, Lloyd's, and submit. There we are. That's very simple for that patient to do. Let's go back to workflow management. Let's refresh this really quickly. Oh, sorry. There we are, done. Okay, so let's go back to workflow management. You can see that that's been submitted there again. We've got one new. So let's view this now. Let's say I want to allocate this to a team or a particular staff member. So you can click on this in progress now because I'm allocating it. I want to allocate it to the administration team, or I want to allocate it to a certain member of staff. You've got the option to do both or one. So let's just say, like, I want this to go to the administration team. Click on save. The audit trail will be there. And if I go back now to my tasks, we can see that in my tasks, because as a staff member, I'm in the administration team, I've got a task in my smart inbox, as we call it. So this is my task. So if you're in a particular team, if you've got 3, 4, 5 members in the administration team, every staff member will see that one task, and any team member can pick it up. If you wanted to allocate it to just a particular person, you can say, okay, well, I want to allocate this to Steph, and save. Then that will still be in my task, but only submitted to me. So notice, if you want to submit it to a person, you can say, well, no team, just want to send it to that person. Then that will only now come, sorry, just refresh that. That will only now come to me in my inbox, not the administration team, because it's been allocated to me, and the full audit trail is down here always. So now I can go back to my task. I can see it. Okay, there's a task there. I can view this. Yeah, okay, I can say coded to EMIS or Vision. I want to copy the audit trail. I can click on save. There we are. I can now say I completed. I can copy the form. That's copied. I can now say completed, save, and now that's gone. So back to my tasks. That task has gone, and back to form submissions. There's nothing left there now. So that's really the workflow system. There's also analytics if you wanted to see what's going on. So you can click on analytics down here. It'll always default to today's date. So we can see that nominated pharmacy has been submitted 5 times today. But if you want to see how you're performing over the week, just select the date and then view. Obviously, this is a test website, so you'd have a lot more submissions here. It'll tell you it's been submitted through the app, the web, or the portal. Excuse me. Now, the portal, if you want staff to, if patients are phoning you to request an appointment or to request anything really, and you want to manage everything through this portal, then staff can just click on offline forms. So any forms you have open in your website or your app, the patient can complete the form on behalf of the patient. So again, let's say nominated pharmacy. They can put the patient's name there. Again, 17th of May 1977, and again click well, and save. When that goes back into workflow management now, you can see that's been submitted. Anything in red means it's submitted today. Anything that's not in a color red means it's older. There we are. That means it's come through the portal. So we go back to workflow analytics. We can see now that there's been 5 web submissions and 1 through the portal. And if you want to make this in progress, you can see, okay, view. You can. I'm making this in progress. I'm allocating it to a team, reception team, save. When you go back to my tasks, there we are. There's 1 there. But when you go back to full workflow submissions, it's gone from new and it's now in progress. So this is really a smart inbox for you really to manage all your patient communications, so that everything comes through with a full audit trail, showing you how much workload you have got coming in. There is one other thing we can show you. If you wanted to automatically workflow forms to teams, we can go to custom form builder, and again, let's go to nominated pharmacy. You can select the time that this form is open from. You can say, okay, well, only in hours, please. I want only what is open between 8 and 6:30 p.m. Monday to Friday. But you can assign this automatically to any team. So you want to assign this to the administration team. So you can save that. This form, when this comes to workflow, will automatically now be sent to anybody who's in the administration team. So you can workflow forms very easily to teams without having to sort of navigate everything that comes into the portal. We can workflow that for you automatically. So that's a very brief, in-depth but quick overview of the workflow system. If you'd like to see this in more detail, then we can do a one-to-one presentation with you. Just get in touch and we can jump on a Teams call. But any questions, please do get in touch. Okay, thank you.